Good morning, everyone. We are standing at a turning point, a time when our health systems are under pressure, our communities are yearning for connection, and the solutions we need might be closer than we think. I want to share a bold yet deeply human proposal to establish a locally led cooperative model for health and well-being across Ryde, Hornsby, and the Northern Beaches. My name is Eugene McGarrell. I am the General Manager for Commissioning for Sydney North Health Network. I'm honoured to be here today. Sydney North Health Network would like to acknowledge their Aboriginal lands and its custodians, the Cammeraygal people of North Sydney region. We would like to pay our respects to past, present, and emerging leaders. As we work to serve the community's health needs, we recognise the importance of the land and waterways as an essential component of people's mental health and well-being. We recognise that Aboriginal and Torres Strait Islander knowledge and learning are integral to the cultural fabric of all Australians. The artwork that you see there has been created by Chris Karmas. What if our communities could do more than cope? What if they could actively shape their own well-being? This presentation has three goals: to introduce the cooperative model and why it matters now, to share real-world evidence of what's working here and globally, and most importantly, to invite you, our community leaders and clinicians and collaborators to help us bring this grassroots vision to life. Why this model? Because people don't just need services, they need connection, agency, and belonging. A cooperative model empowers local people to lead, not just receive care. It creates a bridge between what systems provide, what communities can offer each other, conversation, navigation, companionship, and care. Let's get specific. In Ryde, Hornsby, and the Northern Beaches, we see rising mental health needs and social isolation, especially among seniors and carers. Service inequities, where culturally and linguistically diverse and low-income communities often fall through the nets. And a health system under strain. Emergency departments are crowded. GPs are booked out and allied health is stretched. These aren't abstract problems, they're real stories. People waiting, slipping, and struggling. Now imagine this: a local group of trained volunteers, community connectors, who reach out, listen, walk alongside those who are struggling. A neighbourhood hub where you can drop in, not for a clinic appointment, but for a cup of tea, some advice, a walking group, or a support circle. An initiative co-designed and governed by local residents, supported by services, built for long-term well-being. That's the cooperative model. This isn't theory, it's happening and it's working. In Frome in the UK, a network of community connectors led to a 14% drop in emergency admissions. In Altogether Better, GP practices took on 4,500 new patients, with no increase in appointments by engaging Community Health Championship. In Wanoa Ora, New Zealand, families reconnected with culture, health and opportunity, reducing child health inequity. And Menshed, a quiet revolution, 79% of participants report better mental health. These models meet people where they are before crisis hits, and they work. So here's our vision: to establish a network of well-being cooperatives, one in each of the local government agencies, that mobilize community strengths to build health from the ground up. These won't be top-down programs, They'll be living, breathing networks of neighbours, volunteers, service partners, and everyday heroes. Each local cooperative will include community connectors, trained volunteers embedded in the community, well-being hubs, safe social drop-in spaces hosted in community centres, health navigation, helping people understand and access services early, peer-led groups from new parents to older men, carers to migrants, building health through connection. It's simple, it's human, and it meets the complexity of people's lives with a flexibility, grassroots response. So how do we begin? Local steering groups will be formed with community voices at the core. We'll co-design the model with you, residents, services, councils, and clinicians. Volunteers will be recruited and trained, backed by robust support. We'll launch 3 pilot cooperatives, one per LGA in Hornsby, Ryde, and the Northern Beaches. And we'll also launch a pilot cooperative for First Nations people. And we'll evaluate, learn, and adapt and scale. We're not starting from scratch. This region is rich with community infrastructure. Councils with deep local roots, active men's sheds, and multicultural associations. GPs and local hubs ready to collaborate. Libraries, churches, clubs, cafes, local champions everywhere. The ingredients are here. We just need to connect them with intent and imagination. When communities are strong, the system breathes easier. GPs see fewer non-clinical visits. Hospitals avoid preventable crisis. Patients find earlier support, and services are used more wisely and effectively. In short, this is an investment in prevention. It's an investment in preventative infrastructure that pays social and financial dividends. To get started, we need your partnership and leadership. Help us co-design the model with your community. Identify sites, groups, and local champions. Offer seed funding, shared space, or staff time, however you can contribute. This model is designed to scale with community, not over it, and we can't do that without you. If what I've described resonates, if you believe, like we do, that health starts with connection, we invite you to help us build this together. Let's co-create a new kind of care, one that begins with, "Are you okay?" and ends in dignity, equity, and belonging. Let's write the story of Ryde, Hornsby, and the Northern Beaches as the communities that led the way. Thank you for your time and your service to our communities. We'd love to hear your ideas, your questions, and your hopes for how we can move forward together.